Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin cancer, cosmetic laser surgery, liposculpture, and allergies, and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Tonight, the Medical Explorer will continue our exploration of new treatment techniques in cosmetic dermatology and skin rejuvenation. The unique aspect of tonight's program is that the procedures that I will show you do not require the services of the doctor, but are performed under the dermatologist's supervision. Additionally, the procedures we will show you tonight are non-invasive and do not require time off from work or normal activities for recovery. Tonight we will explore a wide variety of techniques that can be used to treat the bumpy problem of cellulite, remove tattoos by laser, fill in wrinkles with collagen, and decrease muscle contraction wrinkles like crow's feet with Botox. Botox can also be used to decrease excessive sweating. These are simple techniques that make use of highly skilled non-physician healthcare professionals and can dramatically improve the look of your skin. In the pharmacy corner this evening, our award-winning neighborhood pharmacist, Bob Church, will update us about the confusing choice on how do you pick an allergy medication. We're daily bombarded with TV commercials that encourage you to ask your doctor for a prescription for a precise allergy medication. You may have heard about the power of Zyrtec or seen the blue skies that make you say, ah, Allegra. Or perhaps you've heard about the simplicity of taking a once-a-day Claritin. How about newer allergy prescription nose sprays? The choice can be confusing, but we'll get the answers to many of these questions about allergy medications in tonight's Pharmacy Corner. Our program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. Advances in technology may enable scientists to develop an implantable eye chip to treat some types of blindness within the next 10 to 20 years. The proposed new device works by stimulating a small area of the retina with electricity by passing current into the eye, kind of like the way a pacemaker would stimulate the heart to beat. The brain can then interpret nerve activity of the retina as vision or light sensation. The device should someday help those that suffer from macular degeneration or retinitis pigmentosa. These conditions affect more than 2 million people in the United States. Current research obstacles have been overcoming the development of heat within the eye. Just like a computer heats up, these chips can heat up, and you need to avoid the damage to the computer chip from salts that are in the eye, from fluids in the eye. As technology becomes more efficient, the potential for restoring lost vision is getting closer every day, according to these scientists from my alma mater, Johns Hopkins Medical School in Baltimore, Maryland. It's now time for us to visit our pharmacy corner as we learn the latest up-to-date information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in our pharmacy corner is our award-winning pharmacist, Bob Church, from the Medicine Shop Pharmacy in Marysville. Bob, welcome back to the Medical Explorer.
Thank you.
It's just amazing how many new allergy medications have come on the market in the last few years. We've had those previously with a lot of side effects, and now we have many that don't have as many side effects. You must be asked questions about that in your pharmacy all the time. And
well, we are.
Previously, we've discussed over-the-counter products like Benadryl and Dimetap and pseudoephedrine and neosynephrine. We've discussed that, but I'd really like to discuss some of the prescription drugs.
Sure.
Can you help classify them for us and what they do?
Well, we used to have what we called the first-generation antihistamines, which are really the antihistamines that are the over-the-counter antihistamines now that people are aware of, the Benadryl, the chlortrimeton, the Dimetap, as you said. those antihistamines always caused a lot of side effects. There were people who couldn't take those antihistamines from mainly a standpoint of just drowsiness or daily functioning, and some of them were caused a lot of drowsiness. The one that comes to mind, Atarax, we didn't even use it for allergies. We used it more for hives or rashes or that type of thing because the drowsiness was so bad.
You actually want the side effect there to calm them down.
Right. Well, then we got to, just in the last few years, we got to a second generation of antihistamines, and people are well aware of these drugs now. Claritin is one of them. Allegra is another. There was one called Hismanol, which they have since taken off the market, but the nice thing about these new ones was the side effect profile was very much diminished, and people could take these medications, get good benefit, minimal side effects, virtually no drowsiness at all. And now we have another one on the market called Zyrtec, which is very similar. It does exhibit a minor amount of drowsiness, maybe in 10% of the people, but it's nothing that's overwhelming. And these drugs seem to work so much better than the drugs that we had at our disposal previously.
I'm almost dependent on using these through the allergy season myself. If I forget to take it in the morning, I'm in trouble by midday.
Absolutely. I have to do the same thing.
Now, with a pure antihistamine, what symptoms are we trying to work on? Is it like sneezing and
right,
itching?
It would be the sneezing, the itching, the runny nose. Those are the types of symptoms. Not so much the nasal congestion, because we use the decongestants or another set of drugs to do that, but it would be the itching, the sneezing, the runny nose.
Bringing up the decongestants, I guess they have now the combination drugs, which have the antihistamine and the decongestant. Can you tell us about some of those?
Definitely. The Claritin has one called Claritin D, which is make a 12-hour component where you can take it twice a day. They have a Claritin D 24-hour, which for some people, if the decongestants disrupt their sleep patterns, sometimes the 24-hour one will be a better choice and dose it in the morning. But traditionally, the antihistamines don't help so much with the congestion, so if you have a lot of congestion associated with your allergies, nasal congestion, these drugs with the decongestant added to them are superior. Allegra also has one with a decongestant.
Now, unlike the pure antihistamines like Allegra and Claritin and Zyrtec, the ones when you start adding decongestants might have some drug interaction problems or health interaction problems.
Absolutely. We have to be careful with people who have underlying disease states such as glaucoma or high blood pressure or maybe a cardiac arrhythmia problem. And you do get more drug interactions with other drugs, so you have to be aware of that, but they are still very good drugs for specific problems.
You know, I even find myself in practice will give someone a decongestant antihistamine combination in the morning, like maybe an Allegra D, and then at night give it to them without the decongestant.
Absolutely.
Plain Allegra to help them so they don't get interrupted with their sleeping.
Certainly.
I find even myself, if I take the one with the D at night, I just can't get to sleep.
All right. Or you'll go to sleep and you'll wake up because after a couple of hours or 3 hours you get another release of the of the decongestant. And
right. What am I doing sleeping? It's time to be moving around.
That's right.
So we actually will use these and sort of play with combinations
Certainly.
to make it customized to the patient. So.
And you don't have that ability when you're using the over-the-counter drugs.
Now, a breakthrough, and in fact I probably use it right now because my nose is itching right now, but the breakthrough has been allergy sprays.
Oh, yes.
And there's the Astelin now. How is that different than everything else?
Astelin really is as effective an antihistamine in a nasal spray as most antihistamines are orally.
So for the first time you actually have an antihistamine in a spray.
Right, and it affects the nasal passages where you seem to be having a lot of your problem anyway. It's a very rapid-acting drug. That nasal spray, you can start getting a good effect with that in 24 hours.
Interesting. I even see some patients tell me just a shorter time than that even.
Yeah.
So, and then when would they need to add or consider adding one with the cortisone in it? What would be that, like Nasacort or Nasonex?
Those drugs, Nasonex, Nasacort, Becanase, Vancinase, all of those steroid sprays are primarily used when their symptoms are extremely bad or you have a lot of nasal congestion. They work very well for a lot of nasal congestion. But those sprays, people have to be more patient because they're not going to get the effect from those probably for about 4 to 7 days. They really will kick in. And then if they use them consistently, and that's a problem that I have found with people with the steroid sprays, is that they don't use them consistently. They'll hit and miss, they'll skip days, they'll forget doses, and they don't work as well that way. But when you use those drugs consistently, those nasal sprays, they work well. And the steroid component, a lot of people are afraid, well, steroids are going to be like prednisone and affect other parts of my body. They really have minimal impact on the rest of the body.
And so they're not really absorbing a lot of that in their bloodstream
No.
to affect the body like taking prednisone every day for a month
No.
or 2 or 3 might start to do.
That's right.
So, what about eye allergies? That's one that people
Oh, yeah.
often have a lot of trouble with. They'll be rubbing their eyes and they'll be itching and they'll scratch and get red and tearing.
Sure.
You know, they may try Visine over the counter and those to make the redness go away, but will these pills sometimes help those allergies too?
Well, sometimes they will, but actually we have some nice antihistamine drops now for eyes that I think are showing a great deal of promise. There's 2 of them, Levistin and Patanol is another one that we're seeing a lot of prescriptions for now.
They block inflammation right in the eye itself.
Right, yeah, they counteract the effects of the antihistamine, block the antihistamine at the receptor site right in the eye itself. And so the itching and the redness seems to go away much more readily.
Are there side effect problems with those?
I'm not seeing a lot of side effects for those people, no. Maybe just some transient stinging at the point of putting the drop in, but that's a very minor thing.
What about contacts? That's a question that comes up.
Well, people with contacts normally when they're using those drops should take their contacts out and then put them back in later, and that goes with other eye drops too. But,
oh, okay.
Or any other. And a lot of times we use internal medicines that cause your eyes to be dry, and you have to be worried about your contacts. So contacts are obviously a factor.
Are you overall enthusiastic about people's successes with a lot of these new antihistamines and things?
I think the response is much better than what we had before.
Great.
Much better.
Great.
And you have to realize, too, that there's an awful lot of interest in those drugs because, as you alluded to before, there's a tremendous amount of advertisement. So people are asking their physicians for newer medications for their allergy problems. And, that there may be some undue pressure there, but still I think that if people are suffering from allergies, and especially in an area where we live, where it's so bad, they need the relief, so it's probably a good idea that they know that there are some good choices out there.
Well, I certainly like these medications and use them every day. So
Yeah.
again, thank you, Bob. That was very useful and very important information. I hope our viewers will discuss their concerns about allergy medications with you when they see you and their other pharmacists and doctors when they have the next opportunity.
Absolutely.
We look forward to you returning to the Pharmacy Corner on future programs.
Thank you. You bet.
Now on with the Medical Explorer. As you've seen on some previous Medical Explorer programs, the field of cosmetic dermatology continues to advance month by month with new procedures that can improve the skin and your appearance. Let's focus tonight on some non-invasive dermatology procedures that can rejuvenate the skin without pain or downtime from work. Tonight's procedures are unique and they can be performed by paramedical personnel who work with a dermatologist and not just by the dermatologist themselves. Let's begin by having you meet our popular physician assistant, Linda Nelson, who joined our Advanced Skin and Allergy Medical Group several years ago. As a certified PA or physician assistant, Linda Nelson is licensed to work with the dermatologist and can perform a wide variety of medical procedures. Let's begin with a corrective procedure that most of us hope to never have to undergo. Often when people are young or in the military service, they may have a tattoo applied to their skin that they later regret in life that's permanently placed under their skin. Fortunately, with the development of the dermatology YAG laser, we can now remove tattoos with a wide variety of colors. This evening's patient originally had a bright multicolored flower tattoo, and with the help of Linda Nelson, PAC, and the YAG laser, repeated treatments are gradually removing it.
Hello, I'm Linda Nelson. I'm a physician assistant here at the Advanced Skin and Allergy Medical Group, and today I'm going to show you a tattoo removal procedure. We have Shauna here with us this morning. Thank you for coming. Shauna has a tattoo on her arm. This will be her 4th treatment. Each time we do a treatment, it removes a layer of the tattoo. This started out as a blue flower, and we're now to the sun that was underneath that flower. Here are your safety goggles. And I'm going to turn on the laser. It will take approximately 8 seconds, and then you'll hear a clicking sound. Just as before, you'll hear a snapping sound, and you'll feel a warm sensation as the laser goes across. First, we're going to treat the black ink in the center. Okay.